Hi everybody, it's Jeff Markey here with the Facial Plastic Surgery Clinic, and today we're going to talk about rhinoplasty. So rhinoplasty is one of the most common surgeries that we do here at the Facial Plastic Surgery Clinic, and that basically is any sort of surgical alteration that's done to the nose. And so I always talk to my patients and tell them that there's really two reasons why you'd want to do a rhinoplasty or a nasal surgery. Number one, the nose is not working correctly, meaning it's not conducting air from the front to the back in the way they want to. That can affect sleeping, can cause snoring, can affect exercise tolerance, and so on. Make your breathing from one side to the next not quite symmetric. The second would be it doesn't look the way they want it to look. So they want aesthetic or structural or changes to their appearance. And so both of those reasons, sometimes done in tandem, are reasons to undergo a rhinoplasty surgery. And today I want to talk about the four most common cosmetic changes that we make to the nose. So those four changes are: one, there's a little bit of a dorsal hump or a dorsal bump when you look from the side, a very common structural change patients want made to their nose. Number two, the nose is a little bit asymmetric. The components of the nose from top to bottom are a little bit off center, either off to the right or off to the left, or not organized to the midline. Number three, the tip is a little bit too low, which we'll talk about. And then number four, the tip is a little bit too wide. So those four changes are really common changes we'll make during rhinoplasty and common reasons why patients come to me at the Facial Plastic Surgery Clinic. So the first one, the dorsal hump or the dorsal bump, when you see from the side. Now ideally when you look at someone's nose, you could draw imaginary lines from their medial part of their eyebrows here down to the tip of their nose. And it should be a nice organized brow tip aesthetic line that you see when the light hits their nose from certain angles. And a dorsal bump will get in the way of that, or dorsal hump, and so patients often want that changed. And so for men, they usually want a nice straight dorsum. Sometimes women want a straight dorsum, or they want it to be a little bit concave, a little bit sloped. Depends on the patient. We make whatever change the patient's hoping for, but the idea is that either through an approach where you do not make an incision here between the nostrils, or through an approach where you do make that incision, and there are different reasons for both we can talk about in another video, you basically want to bring down the dorsum to the shape that you want it to be, and that's different for every patient. So the second most common cosmetic change that we'll make to the nose are if the nose is crooked, which can happen either just from birth, the nose is a little bit off center, or after a basketball game or a soccer match or something, the nose is broken and it pushes the nose to one side. It's a very common cosmetic deformity that patients want fixed. So if you divide the nose into thirds, like we talked about in another video, the top of the nose is made of your nasal bones. That's what can be broken and fixed in clinic afterwards. The middle part are the upper lateral cartilages, and then the lower part are the nasal tip cartilages. So we really want those to all be in alignment right in the middle, and we fix each one individually, either by gently pushing the cartilage back to the middle, or by adding cartilage to the other side where it's deficient to give it the appearance of being in the midline. But there are all sorts of little tips and tricks that we use to bring the nose back to the middle, and that can again be done either through a closed approach without the incision here, or it can be done with that incision here called an open approach. So the third most common change we'll make to the nose is if the tip is too low, then we'll project it up so it's pointing forwards. And so sometimes, either as you develop, the nose cartilage pushes forward and pushes the tip down a little bit, so when you're walking, the tip of the nose is pointing towards your feet. Or sometimes with age too, the ligamentous structures of the nose can stretch slowly and the tip can drop a little bit. But one of the most common changes we'll make is by bringing the tip up slightly and defining it in a better way, so that the most projected part of the nose, when you look at it from the side, is pointed forward and it's right there on the tip of the nose. And so again, that can be done through a closed approach or an open approach, but ideally, the most projected part of the nose, as you follow that line from the eyebrows down to the tip of the nose, should be the nasal tip. And so that's a common change. And then lastly, the fourth most common cosmetic change we'll make to the nose is the shape of the tip itself. A lot of times the lower lateral cartilages that make up the nasal tip can be too arched, too broad, and can make the tip appear too wide. And so we want to have just the perfect ratio of the nasal tip to the rest of the nose, so that again, you follow the line down and it ends in 2 points right on the tip. And so we'll make changes where we narrow the tip of the nose either through suture techniques or more robust techniques through an open approach to give that nice, sophisticated nasal tip appearance. So once again, the dorsal convexity or dorsal bump or dorsal hump, a crooked nose, and then making changes to the nasal tip either by reprojecting it upwards or by narrowing the tip. They're all common changes that we do here in the Facial Plastic Surgery Clinic during rhinoplasty. So thank you for watching, and we'll have more videos to come soon.